Greetings from Bilmed Ultrasound Training Institute. Today we will be taking a short demo of what we have to do when we are switching from a grayscale to color Doppler. Machine itself will not improve the image by pressing onto the color Doppler. Don't think that the machine's resolution will improve, machine will show you good quality image. No. In fact, the resolution, the frame rate of the machine will drop when you will switch from the grayscale to the color Doppler. That is why your grayscale image will get blur. You will see colors only, but not always even you will see colors, because you have to do many knobs you have to play with. You have to set the machine, then only machine will show you a good color Doppler image. We cannot here make you understand each and every knob. I will give you a brief demo of what precautions you have to take that your image quality will improve. First of all, have a basic understanding of these colors, what this red is about, what this blue is about, why the baseline is having the flow on the top, and why sometimes it is getting onto the other side of the image. For that, you have to understand the physics behind this color Doppler. A detailed course of this color Doppler settings is available on our server bilmed.net. The course is of about a 1 month. I mean, this color Doppler course settings is of 1 month, but we are today discussing in brief what we have to see. So have a basic understanding of the angle of insonation. Angle of insonation is very, very important. You have to hit with an appropriate angle, and that is the angle of insonation, which has to be less than 60 degrees. So 60 is the cut. Now what is the angle of insonation, how you have to take that? For that there is a course, but here we are giving you some basic important points what you have to keep in mind. So keep in mind the angle of insonation. This angle of insonation should be less than 60 degrees. Then if your angle of insonation is about a 90 degree, you will not see a good color, and then you will be blaming yourself, or you will be cursing your machine why the color is not popping up, because you are hitting with a wrong angle. So color angle of insonation is very, very important. Then practically how this color of the insonation angle, the angle of insonation means that your vein, artery, whatever the vessel you are scanning should not be by 90 degree, should not be hitting by 90 degree, but should be hitting with a lesser of the angle. Lesser the angle, more the clarity of the color. Now see over here, this vessel is getting hitted by 90 degree. That is why the color is missing over here, and this vessel is having a less angle. That is why I am here having good flow, and I am here having very less of the flow. So this is the importance of the insonation angle. Then the size of the color box, the overall size of the color box should not be a big color box. You have to put a small color box. Smaller, better for the overall resolution. Now here I am interested in this area only. What is the use of putting this much of color box when my area is very small? So put a smaller color box. Smaller the box, more the clarity of the color. Bigger the box, lesser will be the resolution of the overall image. So keep your color box as small as possible. Then appropriate gain. If you have overgained the image, then you will see that there is an overlap of the colors. So set an appropriate gain. Then the same gain knob will now behave like the color gain. Now you have to set it so that you are seeing the vessel only, not the overlap of the colors. By setting your gain. So keep your gain appropriate. Then one more important point is that whether the box, the color box, should be more vertical or more horizontal. If your color box is more vertical, now see, it is more vertical over here, this will increase the frame rate as compared to the color box which is horizontal. So don't keep your box horizontal, try to keep it more vertical, because if it is more vertical, more will be the frame rate of the machine. Now these are the very basic 2 to 3 points only by which you can improve the image quality when you are shifting from the grayscale to the color box, color Doppler. By pressing onto the color, you will not get the flow, you will not get the color, but by understanding what I have to do, you will do wonders with this color Doppler. So complete course of this color Doppler is available with Bilmed Ultrasound Training Institute. So contact our helpline number for an inquiry regarding the color Doppler or the physics of the color Doppler. Thank you very much.